wonderful people. How are you doing today? I hope you're fine. Happy New Year to you all from Health Conferences Corner. I hope you've made wonderful plans for this year, and I hope you have committed your plans into God's hands, because He alone can bless your plans and bring them true. Okay, today I think we have something really wonderful to talk about, and that's peptic ulcer disease. Do you know peptic ulcer has become closer to us than we ever thought? I mean, it has become something very domestic. It has become more like a lifestyle. You hear a lot of people say, I have ulcer, I have ulcer. You could even have a very close friend and you wouldn't know he or she has peptic ulcer until after a very long period of time. It has become very close. It has become very common amongst people around the world, and I think it's about time we just dealt with it, because peptic ulcer has a lot of deadly complications that could result in death. Okay, now what's actually peptic ulcer? Peptic ulcer is an open wound on the inner lining of the gastrointestinal tract. That's the digestive system, where we have which begins with the mouth, and then we have the esophagus, the stomach, and the intestine. So peptic ulcer is actually when the amount of the hydrochloric acid produced by the stomach to deal with microorganisms present in food overpowers the thickness of the inside lining of the GIT. Because the inside lining, the mucous membrane that lines the GIT, protects the GIT from the harmful effects of that acid, hydrochloric acid. But when the amount of this acid overpowers the thickness of that protective membrane, the protective stuff, peptic ulcer results in. Ulcer is a wound, so there will be a wound on the GIT, on the intestine, on the digestive tract, and that is what we call peptic ulcer. Now, let's get deeper into it. How can we describe it more? Let's look at the signs and symptoms. When do you know you have peptic ulcer? You may just be hearing the definition and then you still don't understand, but when you hear the signs and symptoms, of course you'll be able to relate more with this. You can say, okay, so that thing this person has been experiencing must have been peptic ulcer. Now, the first and most obvious sign is a burning pain in the stomach. Of course, you may not know where exactly your stomach is, but of course you know the area. So when you feel that dull and burning pain down there, it's likely to be peptic ulcer. Another thing is heartburn. You feel a burning sensation along your chest. This is usually caused by the hydrochloric acid coming up. That's a reflux of this acid causes that burning sensation, which is known as heartburn. Another thing is bloating. You feel bloated in your abdomen. You belch from time to time. Yes, you belch. Another thing is nausea and vomiting. You could feel nauseated because of this acid. You feel nauseated. Another thing is loss of appetite. You lose appetite because of this pain. Of course, this pain will make you not able to eat. That's one other thing. Another thing is quick satiation. You feel full when you eat very little thing, because of course this pain now, of course peptic ulcer could be at the level of the esophagus, could be at the level of the stomach or intestine. Now, as food passes, when you take something, no matter how little, as it passes, trying to pass down, of course there's a distension of the parts. So this distension, of course, causes more pain, and that makes you feel full whenever you take something very little. So quick satiation is one of them. Now let's look at the causes of peptic ulcer. The first thing we're going to talk about is the bacterium. There's a bacterium known as Helicobacter pylori. That normally is a normal flora found in the GIT. It has its economic importance, but it could also burrow into the walls of the intestine, causing an ulcer. Another thing is prolonged use of non-steroidal anti-inflammatory drugs. These are such drugs as diclofenac, ibuprofen. We talk about aspirin. Now, the prolonged use of these drugs causes a depreciation in the amount of the mucus produced, this protective substance that lines the intestinal tract. So, a prolonged use of this drug is one of those factors that can make you at risk, that can keep you at risk of peptic ulcer. Another thing is starvation. I won't call it, okay, should I call it a hunger strike now? Most of us don't eat. Some of us, okay, we talk of anorexia nervosa. When you try to not eat, maybe try to skip breakfast and maybe probably lunch, you do 010 or 001 for one reason or the other. When you over time avoid skip meals, you expose yourself to this condition because, of course, this hydrochloric acid increases in amount in the absence of food. And of course, it's when it increases in amount, of course, it will definitely one day eventually overpower the thickness of this protective substance that lines the GIT. Okay, now let's look at the aggravating factors. Let's look at those things that increase your symptoms, that worsen your symptoms. As an ulcer patient, you have ulcer and you know you have it. Let's look at those things that can worsen your symptoms. Smoking is one of them. Smoking as an ulcer patient increases your symptoms, increases the pain and every other symptoms, increase in the hydrochloric acid and many more. We talk of alcohol, excessive use of alcohol. Alcohol on its own thins this membrane, this protective membrane. So, of course, when it's thinning the membrane, eventually the amount of hydrochloric acid overpowers the strength of the protective lining. And so, it worsens your symptoms. Let's also talk of use of consumption of super spicy foods. Super spicy foods also increase the symptoms, like pepper and every other, the Maggi and many other spices, they worsen your symptoms. Also, intake of citric fruits, like oranges, lime, tangerine, grapes, lemon. This also can worsen your symptoms because already these fruits have the acetic acid in it, and of course bringing them in and then adding up to the hydrochloric acid, this increases the amount of acid and worsens your symptoms. Okay, now let's look at the treatment of peptic ulcer. Of course, first you have to go to the hospital and be diagnosed. There's no room for self-diagnosis. You have to be clinically diagnosed to have ulcer in order to treat it effectively. Okay, so you need to communicate this to your patient. When you start having those symptoms, you feel pains, you feel this burning pain, heartburn sometimes, you need to, especially when you've not eaten for a period of time, please visit the hospital. You see the doctor and then all the investigations will be carried out and then the diagnosis is your doctor comes up with the diagnosis for effective management. So please go to the hospital. And of course, you don't need to hear about the drugs from me. When you see your doctor will tell you what you need to go for. Because we could use antacids, we could use antibiotics, proton pump inhibitors, and so many other classes of drugs. Now, your treatment, the best treatment for you depends on the cause of your ulcer. So if your ulcer is caused by the bacterium, of course, you need to go for antibiotics. If it's caused by you just need to communicate to your doctor, visit the hospital, and be clinically diagnosed for effective management. Now, if after the diagnosis, please, you need to adhere to every instruction from your physician. Avoid what you're told to avoid and stick to your drugs. Adhere strictly to your drugs, because let it not be because you don't feel the symptoms anymore, you're relieved for a period of time, you decide to go back to those things you're supposed to avoid, because you could actually be healed of ulcer, but if you don't adhere to instructions, if you don't avoid those things that you need to avoid, there could be a recurrence of peptic ulcer. Okay, so now let's look at the complications. Of course, if you don't manage peptic ulcer properly, there are several deadly complications that could come up. We talk of bleeding. Of course, there's an injury on the lining of the intestine, so there could also be bleeding. Sometimes you could bleed internally to an extent that you need blood transfusion. So you have to avoid this. You have to properly manage peptic ulcer in order to avoid this complication, bleeding. You could bleed to an extent, I repeat, that you may need blood transfusion, and of course, so many things could come up from there. Another one is infection. Yes, infection, a generalized infection, peritonitis, can result if there's perforation. The ulcer could be mild, but if you don't manage it, this wound goes deeper and eventually there could be an opening. It could bore a hole into the major house of the abdomen, causing generalized infection. And of course, this can result in so many things and eventually can cause even death. Another thing is obstruction. Now, when there's a wound, in the healing process, there's formation of thick tissues, very hard fibrous tissues, and this narrows the area. So continuous narrowing of this area can eventually cause obstruction to the passage of food, and of course there you hear of intestinal obstruction, and then you need to go in for surgery and so many other things. Please, we need to manage our ulcers very well to prevent these deadly complications. Now let's talk of prevention. We know prevention is easier and cheaper, way cheaper than cure. So now how can we avoid the whole of all these things? Now we talked about the bacterium, Helicobacter pylori. Research has found that this bacterium could be transferred from person to person. So of course you need to learn the habits of regularly washing your hands, not only after using the toilet or after reading or after doing something that got your hands dirty. You need to wash your hands from time to time. You also need to avoid deep kissing, because kissing also, this bacterium could transfer from person to person through kissing. Another thing is avoid prolonged use of NSAIDs. Sometimes we just get these drugs over the counter. We just go to a drug store and we say we need diclofenac because we feel one pain or the other. Please do not. This is drug abuse. Do not abuse drugs. Do not use drugs that are not prescribed to you by a physician. Meet a physician to prescribe any drug you need to take. And of course, if you don't do this, you could just abuse drugs and take any drug without, of course you don't know the side effects of these drugs. You don't know what they're likely to cause. So please use only drugs that are prescribed to you. Another thing is, please don't starve. Do not starve. Do not starve. I'm not saying you shouldn't fast. Please, I join my faith with yours. Fast, but try to not skip meals as much as you can. Try as much as possible to not skip meals. Now, it is found that peptic ulcer affects men more than women, because we feel, okay, men go to work more and they may not have the time to eat. Please try to eat small, frequent meals. You may not have the time to eat a lot, but just eat something from time to time, and then you'll be doing yourself more good than harm. Okay, I think I've spoken at length. Please don't forget to subscribe to this video, to this channel. If you're still yet to subscribe, don't just watch. Subscribe to this channel to get fresh videos every Friday. Thank you for watching. I wish you a happy new year once again. See you next Friday. Bye bye.